If the system's designed to protect you, from your local hospital to, well, the highest levels of government, are actually prioritizing their own profit or convenience, how informed can you truly be?
That's really the core question we have to face today.
Yeah.
The sources we've compiled for this deep dive, they reveal a pretty clear pattern of what you could call institutional misalignment.
And it's not just, simple human error.
No, not at all. It seems to be about deliberate decisions that put the system's best interests directly against the individual's safety, or at least their well-being.
We have a really challenging stack of material today. It covers investigative reports, firsthand accounts, and it crosses three major areas. We're talking about a terrifying medical emergency where a surgeon's vacation schedule might have dictated a patient's diagnosis.
That's incredible.
Then there are these new profound questions being asked about alleged data manipulation in vaccine trials, and finally a look at the just astonishing multi-million-dollar surge in wealth for a politician's family.
And all of this happening during a massive public financial scandal.
Right.
So our mission today is really to give you a shortcut to understanding the institutional failures these sources are highlighting. We're unpacking these stories, medical, pharmaceutical, and governmental, to show why personal vigilance is so critical.
And why we have to demand real accountability.
Exactly, because these systems are, well, often far less trustworthy than we've been led to assume.
Okay, let's unpack this. We should start with a story that really puts the stakes into immediate focus. It's about the 24 hours that changed one family's view of American healthcare forever.
This is the story of Bud. He's a construction business owner, early 50s, and his family's starting point now with the medical industry is just profound skepticism.
Their approach is basically guilty until proven innocent.
That's it. So Bud arrives at the ER with just crippling gut pain. The initial reading of his scans leads to this immediate, frightening diagnosis.
A significant section of his colon was necrotic, dead.
Yes, and the only procedure on the table, an emergency resection surgery, which meant he'd have to use a colostomy bag for at least 6 months.
For a man whose entire livelihood depends on physical labor, I mean, that's not just a medical issue, that's career-ending, financially devastating.
Completely, and the red flag started going up almost instantly.
So they get assigned this surgeon, let's call him Doc #1.
And this doctor immediately creates friction. He refused to speak with Bud personally before the surgery.
What was his reason?
He claimed it was standard practice, that he, quote, never saw any patient before surgery. That level of detachment, right before a life-altering procedure, it should be alarming to anyone.
It's terrifying.
And here's something that people often overlook, how the system financially traps you in these moments. Bud and his wife, they desperately wanted a second opinion from another hospital nearby, but they quickly realized if they transferred, they'd be hit with these massive out-of-pocket costs at both facilities.
So they're cornered.
Completely cornered. Forced to trust a doctor they already had serious doubts about, simply because they couldn't afford the freedom to, shop for better care. That right there is a fundamental failure of the system.
But fortunately, Bud's family had an advocate inside the industry.
Right. His daughter is a surgical nurse. She stepped in, moved mountains really, to get a second opinion from a friend of hers, a former military doctor, Doc #2.
And the timing was just miraculous from what the source says.
It was. The planned colonoscopy prep that morning had been messed up by the nursing staff. So when Doc #2 arrived, he reviewed the scans, the notes, and delivered this critical reversal.
He confirmed Bud was negative for cancer.
He did. And more importantly, he said the dead colon wasn't necrotic tissue at all.
So it didn't require that immediate drastic surgery.
Exactly. It was a severe, long untreated infection from diverticulitis.
Wow, that's a completely different diagnosis. It changes the entire timeline. One path is immediate debilitating surgery. The other is medical management.
Precisely. Doc #2's plan was so much more patient-focused. He said, let's prescribe a series of antibiotics right now to treat the infection.
And then deal with the underlying issue later.
Months later, with a less invasive robotic laparoscopic surgery, no colostomy bag, and he predicted only a 4-day hospital stay. I mean, the difference was night and day.
So the big question is, why did Doc #1 push so aggressively for that immediate more invasive and, as it turns out, unnecessary surgery.
Well, according to the source, what Doc#2 later revealed was that Doc#1 was scheduled to leave on a 2-week vacation.
When?
The day after Bud's initially scheduled surgery.
You're kidding me.
The source suggests this rush was potential malpractice. It shows how a physician's, personal convenience could actually override clinical best practices.
And put a patient at extreme risk.
Absolutely. A surgical outcome that could have been disastrous if Bud hadn't had an advocate fighting for him.
That story is it's terrifying. It really shows the need for individual vigilance when you're up against what the sources are calling institutional self-interest.
It does.
But if that's happening on the individual level, let's talk about how this plays out on a massive systemic scale. I'm talking about public health agencies.
That's a crucial transition. Bud's story is one hospital. Our next set of sources looks at government agencies and big pharma. Following the 2024 election, we saw Health Secretary Robert Kennedy Jr. take a major step.
The reconstitution of the CDC's Advisory Committee on Immunization Practices, the ACIP.
That's right. And the stated goal was to fill that committee with experts who reportedly have no conflicts of interest with pharmaceutical companies.
This new group, it features people like Retzef Levi from MIT, Dr. Robert Malone, and they're doing a deep review of the COVID-19 mRNA shots.
And they are finally asking the profound, complex questions that, were aggressively sidelined during the initial rollout.
The list of things they're looking into is long. It covers things like biodistribution, persistence of the spike protein.
Right. And for anyone not familiar with that jargon, biodistribution just means where do these things go in your body after the shot? Do they stay in the arm or do they travel? Persistence is how long do they stick around?
Okay, that makes sense. And what about the long-term impact? They mentioned IgG4 class switching and immune imprinting. Why are those specific things a concern?
Well, what's fascinating is they're looking at the cumulative effect of repeated boosting. Immune imprinting suggests your immune system might get stuck focusing on the original virus strain,
making it less effective against new variants.
Exactly. And IgG4 class switching is really important. It could mean the immune system starts treating the spike protein as a non-threat, which might lead to a state of, immune tolerance or even reduced long-term protection.
These are deep, serious scientific questions that need answers.
They absolutely do.
Now, the source material is pretty sharp about the initial rollout. It says authorities made exaggerated promises that the shots would stop the spread,
which was quickly proven to be untrue.
But the most serious claim here is about negative efficacy. Can you just clarify for the listener what that means in practical terms?
It's startling. Negative efficacy doesn't just mean the shot failed to work. It means that at certain points, the data allegedly showed vaccinated individuals were statistically more likely to get COVID than the unvaccinated.
So, more likely to get sick with the shot than without it.
That's what the data was suggesting, according to these sources. The trend was there, completely undermining those initial claims of protection.
And this is where it gets really interesting regarding the data itself. The sources expose what they call a little trick that was allegedly used to hide adverse effects. How exactly did they gain the safety data?
This is a critical point. People were not counted as vaccinated until 2 weeks after their second shot.
2 weeks?
Yes. So any injury, hospitalization, or death that happened inside that 14-day window, which is often when acute reactions would appear, was categorically put into the unvaccinated group.
So by drawing an arbitrary line 2 weeks after the shot, they were essentially mathematically suppressing the most immediate and severe safety signals in their own data.
Precisely. It artificially lowered the adverse event rate for the vaccinated group, while at the same time inflating the perceived risk for the unvaccinated. It let them move forward with what looked like a clean safety profile.
And this data manipulation appears to be a systemic issue.
It seems so. The sources point to other investigations, like into a major RSV shot trial that showed similar alleged practices, splitting test subjects to bury safety signals, cutting the trial off early, hiding evidence of deaths in footnotes.
So it suggests a pattern of prioritizing product approval over transparent data.
And that realization that institutions in charge of our health and safety were allegedly engaged in this kind of data manipulation. That's why public faith eroded so badly. The new ACIP committee has a monumental task ahead of them.
Let's pivot now from failures in health institutions to, a related problem. Accountability in government and the courts. We have to look at the financial disclosures of Representative Ilhan Omar's husband, Tim Minette.
The numbers here from the source documents are they're almost unbelievable. In 2023, his firm, Rose Lake Capital, had a disclosed value of, at most, $1,000.
Basically nothing.
Negligible. Yet by 2024, its value had suddenly soared to a range between $5 million and $25 million.
In 1 year.
1 year, it's a thousands-fold increase. And a related winery had a similar jump, from under $50,000 to up to $5 million.
And this explosive accumulation of wealth is happening while Minnesota is dealing with allegations of $9 billion in government program fraud.
And what's fascinating here is the impulse towards secrecy. As public scrutiny started mounting, Rose Lake Capital reportedly just stripped its website of prominent names. Former DNC officials and ex-ambassador, they were all removed.
So why scrub the identities of politically connected advisors just as your net worth is exploding?
That's the question, isn't it? The sources suggest it's a pattern of wealth accumulation that tries to avoid public sunlight.
Meanwhile, other sources point to the judicial branch seemingly undermining executive authority. Let's look at the Obama-appointed judge, James Boasberg. He quietly released a woman who had traveled with a stated intent to kill President Trump.
With a bladed object.
Yes, and the context here is key. The Secret Service knew about her persistent threats. Her bond had already been denied by another court.
And yet Judge Boasberg just released her, mandated electronic monitoring, and a mental health visit. That's it. It sends a message that these kinds of threats can be treated very lightly.
And we see similar patterns. A relatively new Biden nominee, Judge Sparkle Suknanen, reportedly overruled President Trump on a deportation issue not long after taking the bench.
And then there's the federal judge who ruled the Trump administration's deployment of National Guard troops during protests in L.A. was illegal. But here's the strange part.
He didn't actually order the troops to be withdrawn.
No. Which makes the ruling feel, well, impotent. It's like a paper victory. It establishes a legal precedent that the administration acted unlawfully, but it avoids the practical step of actually overturning the action on the ground.
Political maneuvering, dressed up as judicial oversight.
It looks that way. And if we connect all of these dots, from the hospital negligence to the alleged health data manipulation to the political wealth, and finally these judicial interventions, they all point to the same central message.
A severe breakdown of integrity in these powerful systems.
That's what the sources are showing us.
So the core takeaway for you, the listener, isn't to despair, but to understand that this requires really a kind of radical self-reliance. You have to operate with the same healthy skepticism that Bud's family adopted. Never just take institutional pronouncements at face value. You have to advocate for yourself and relentlessly question the motives of those in power.
Because they've shown repeatedly that convenience and profit can often win out over truth and public safety. Your greatest, and maybe your only, defense against this is just unrelenting, informed skepticism.
And think about this. If people in positions of authority are willing to hide safety data or risk a patient's life for something as simple as a 2-week vacation, what other high-stakes truths are being hidden right now for billions in political or financial gain? That ultimately is what you have to keep questioning.